Hi, everybody, and Happy New Year. I'm Jay Cook, the Chief Medical Officer here at Prov Everett. I hope you had a peaceful holiday and were able to spend time with your family and friends. We have a lot to be happy about this new year here in Everett, and I want to list just a few of the many things we accomplished in 2019 that we should be happy and thankful about. Thanks to the hard work and focus of all caregivers, we dramatically decreased the number of patients who developed new infections during their hospitalization in 2019. We've also decreased the number of times patient needed to be readmitted to the hospital within a month of their discharge. These actions reflect your team's diligence in making sure patients are ready for discharge and have a smooth transition to their home or other place of care. Keeping patients safe while they're in our care is one of the most important jobs all healthcare workers have, and you've done incredible work to improve patient safety. This should make us all happy. In the past month, we've opened 32 new inpatient beds on the 9th floor of the D Wing and opened 3 new operating rooms on the 2nd floor. We're all happy that we've increased our capacity to care for the increasing number of patients needing our services. Last fall, PMG opened the Behavioral Health Urgent Care Center on the 1st floor of the medical office building. This unit has already made a huge impact on the health of our community, and we should be happy and proud to have the only urgent care center dedicated to behavioral health in the entire region. Providence also received $8.4 million in grants from the state to help create an inpatient mental health unit in the A Wing. We'll start construction later this year and plan to open it in 2021. This will fill another gap in our region's healthcare needs and is another reason to be thankful and happy. There are many more examples of positive changes we've been blessed to experience over the past year. Yet we know there is much more work to be done to improve the quality and cost of care for our patients. We're thankful that a tentative agreement has been reached with the United Food and Commercial Workers Union that represents about 650 of our technical and professional teammates. We'll have another different discussion this fall with that union regarding our nurses' contract. These labor negotiations impact our leaders, caregivers, and patients in many complex ways. Through it all, we want to find ways to increase the feeling of belonging and connection to our mission and values for all caregivers throughout our ministry. That's a good segue to recognize those caregivers who were selected recently as recipients of our Values in Action Awards this year. These awards recognize individuals who consistently demonstrate one of the 5 key values of the Providence St. Joseph Health System. To be honest, for me it's sometimes hard to remember exactly what these 5 key values are. One trick I use is to remember Compassion Jedi. This stands for compassion, justice, excellence, dignity, and integrity. With that mnemonic in mind, this year's selections are, for compassion, Kelly Kikuchi, Manager of Financial Counseling. She leads the team of financial assistance caregivers in a way that builds compassion as they help financially vulnerable patients facing the high cost of medical care. For justice, Dr. Tom Roby, ED physician from North Sound Emergency Medicine. He was chosen for his advocacy on behalf of vulnerable patients with substance use disorder and those who do not have physical shelter for their time of recovery. For excellence, Megan Delahanty, Spiritual Care, who identifies and works towards resolving system gaps that impede compassionate support for patients, families, and caregivers via palliative care and sensitive conversations. For dignity, Michael Roberts, who makes the most of sacred encounters that take place across the food counter in the cafeteria. He works with the awareness that cafeteria customers may be meeting him on their worst day and are in need of affirmation and encouragement. For integrity, Dino Menace, staff RN on 4A, who quietly does the right thing and serves with authenticity, simplicity, and humility. Congratulations to these 5 caregivers and to the 30 individuals who are nominated for one or more of these awards. Finally, don't forget to complete the HealthStream module that deals with lab specimen labeling. We have to consistently and reliably get this right to avoid making errors that can harm patients. Quick tip, use the CareFusion label when available. That's all I have for now. Thanks for watching. and thanks for making Prov Everett the place where patients choose to come for their care.